Good afternoon, everyone, and thank you for joining me today. Today's topic of discussion is, what do we know about Asperger syndrome? Asperger syndrome is defined as a developmental disorder, further defined as autism spectrum disorder. Some common patterns associated with Asperger's includes poor socialization skills, average or above average intellect, mobility disorders, and peculiar behavior. The reason for me selecting this particular topic is due to my own personal family struggles, which include searching for an answer to explain my daughter's behavior. Before 2010, my husband and I had no idea how to help our daughter. Furthermore, we had no clue as to what, if anything, was wrong with her. But through a tutoring and note-taking position that I attained with Students for Services with Disability program at FSCJ, I was able to make the connection and request the proper testing of her. After 15 years of searching for a diagnosis, our daughter was diagnosed with Asperger's. Since her diagnosis, we have been able to place her in the proper school setting. She receives behavior modification counseling. Also, we're better equipped as parents to provide her the support she needs to deal with the issues and behaviors associated with Asperger's. Asperger's was discovered by Hans Asperger in 1944. He conducted tests on 4 boys and identified patterns of behavior and abilities that he called artistic psychopath. The patterns included a lack of empathy, little ability to form friendship, one-sided conversations. Although Asperger's was studied and diagnosed in 1944, its findings have been questioned, challenged, and remains an issue of controversy throughout the years. Symptoms of Asperger's disorder is usually first noticed in childhood. While many of the symptoms we will discuss are common to the disorder, each person is unique in terms of their behavior pattern. Young children and teens may display behaviors such as poor communication skills. There's no developmental delay in speech. And often kids with Asperger's language skills develop earlier than normal. Although there's no delay in verbal skills, nonverbal skills may lack emotions such as empathy. Often there are difficulties with interpretation of nonverbal cues, such as body language or facial expressions, as well as difficulties with socialization skills, avoidance of eye contact, issues with pattern language such as poetry or pragmatic language. Parents, teachers, and professionals such as pediatricians that may have concerns about a child's behavior or communication skills should confer with a specialist for developmental screening and have comprehensive testing done. There is no cure for Asperger's. There are individualized treatment plans, behavior modifications, and intervention to meet specific needs. Treatment plans are developed to meet the individual need of the person. Some treatment plans may incorporate the use of medications such as Adderall or other medications to offset conditions such as depression or anxiety. In recent days, Asperger's have been in the news, widely in the news, primarily because of the Newtown shooting. According to an article in USA Today, Asperger syndrome experts say that there's no connection between the disorder and violence. Asperger's is a mild form of autism, often characterized by social awkwardness. There's really no clear associations with Asperger's and a violent behavior pattern. Another issue of controversy is with the Diagnostic Statistic Manual of Psychiatry, better known as the DSMV. Due to be published in 2010, Asperger's will no longer be classified individually in the new manual. Instead, it will be conjoined with autism under one general umbrella. Regardless of the debate of the issues surrounding Asperger's, everyone needs to be more aware of the disorder. Thank you.